global health policy expert. Mario, always a pleasure to have you on. The panel said the combined response of the WHO on the one side and governments around the world. So we're talking about science possibly versus politics. They call it, the report, a toxic cocktail. Do you agree?
Good morning, Adnan. I tend to agree with this assessment. And, it is, though, pretty much an issue of shared responsibility, right? Because through this whole crisis, we have seen a big governance issue with no real global strategy and quite little coordination. So, we were all hit at the beginning. This was like a feared scenario that was becoming real and fast. But whether it is somewhat understandable that there was no coordination at the top of the pandemic, I think it's less acceptable, the lack of coordination throughout this pandemic. And we have seen that, for instance, at the end of the first wave in the Western countries, right? There was some sort of naivety, some sort of relaxation. The report is mentioning February. I would mention end of first wave, in most of the Western Europe, where basically you didn't have investments into intensive care units and other type of measures that would have really eased the second wave and that pressure on the second wave. What is really staggering is the inconsistency. And general guidance and assistance to country is inconsistent. The type of and the modality of implementation of the restrictions is also being inconsistent throughout countries. So you have a lot of confusion there, and I guess that's probably what is underlying in the report of the WHO of the panel. Sorry.
The thing is, Mario, as an expert in this field, when you look back to as the virus was approaching Europe, because you're right, the report does specifically say that the European countries were too slow to react. I mean, how was that actually possible? The report talks about a lack of preparedness, and it's so obvious when we look back at it now, but why were governments so slow to react? Was there something in their systems that was stopping the preparedness being in place?
This has been I will say a lifelong conversation in WHO, because it's not the first time that we are threatened with a pandemic. We had, of course, all the various influenza viruses in the mid 2000s, 2010s. Then we had the Ebola. So it's not that the guidance was not there. I think it's more an issue of all the time needing to kind of look into the making decisions that are also popular and also are somehow serving the electorate, right? Now, we are living in this era of information explosion. So where basically when you make decisions, you need to take into account that the general public has an overwhelming access to information, right? Fake or real, it's irrelevant. So the question there is that there was lack of preparedness, but there was also very confusion into the messages. If the message is confused, then the people are confused. So there has been that's, I think, has been the main failure. And I'm not blaming the governments. I mean, the crisis is medical, but it has deep societal impact. So you need the science to go hand in hand with the politics, let's say, with the politicians. And what we have seen is that these authorities are speaking with different voices and out of different narratives. And I think it's shocking because, for instance, look at the confrontation between governments and pharmaceutical companies a few months ago in Europe. That has really created a problem, I will say, in terms of people understanding and like society being prepared. So on one side, the governments were not prepared, and that's really on them. On the other side, there was not really like an effort to ensure consistency in communications that will make the people prepared for the scenario we are living now.
Okay, so hindsight is, of course, 2020, and it's perfect. Let's look at where we are now. And one of the recommendations that it makes about vaccines having to be classed as public goods. And then it goes on to say that actually money should be provided for schemes like COVAX, the international effort to get vaccines to less developed and poorer nations. Are we now, until that happens, until the whole world is vaccinated, are we going to be living in sort of two parallel worlds? One where there are countries that have vaccinations and the other where largely they don't?
Well, it is a fact if you see the numbers at the moment, right? We are going into that direction. If you see what's happening in some countries in Europe, for instance, in the US, and what's happening, for instance, in India. The answer is pretty simple. yes, we may risk, and it's dangerous because we know that the pandemic doesn't end when you have the vaccines and when you will have new therapeutics. It ends when everybody is getting them. And there is a large portion of the world that is not getting any care. Like vaccines, it's a chimera at the moment, just care that is not there. And there is a stark difference in how the countries are dealing with the economic crunch, because the lower income countries cannot simply afford some of the measures that are being taken in wealthier nations, where people are compressed, middle class is in difficulty, but the wealth of the country allows for that. So the danger is defaults, insolvency, social unrest, and the solution, of course, there is a wealth of solutions into that panel. And I will add that we need a global costed financial strategy that looks at the full picture, right? It's kind of yet another call for global solidarity and use the tools that we have, COVAX, improve the WHO leadership, and also again looking at kind of creating this this world approach to resolving this problem.
Well, it's a world problem, isn't it? Yeah, absolutely, as you said. Mario, thank you so much. As I said at the start of the interview, always appreciate your contributions. Mario Ottiglio in Geneva.